Despite the previous challenges to the success of the national budgets, ranging from the COVID-19 impact, uncertainties from political instabilities, and forecasted climate changes resulting into crisis and the deficit of the national funding, to misallocation, corruption, and embezzlement of the pre-estimated expenditures for as far as the national budget is concerned. Today, one day to the reading of the national budget, Uganda scientists and health workers have raised their voices of expectations from the national budget to the state. Their suggestions center to the government having more designated funds for transport and construction of roads, revamping education, and having more portions of the budget directed to the health sector.
Increment, that's an obvious case. There's going to be an increment in the monies, for example, I think these guys have to increase monies to work on these roads. Like this road I'm talking about, you see it has some potholes. They should increase some money in education, because for real education services are very low and they are very poor compared to other countries.
Like in this education system that they are put in place, most especially for those in secondary. So education should be fostered well, right from the roots. Yeah, I think that will change the perception of the people's attitude and mind about the education system in Uganda. So I think they should look into both things.
Health is it's the priority. So I'm expecting government to put more about the health sector and maybe education sector too.
Uganda, basically we are still not hoping much. Instead, it is only disappointments, majorly in health, which we mean that the health is for all, the poor and the rich. But here, purposely me, as Njamachi Dennis, I should be considering in this budget, health to be first. But I was again recently disappointed when I saw Minister disappointing his fellow, even majorly health minister disappointing his fellow health personnel who are interns. That it should be that they should lose their payments. Purposely, for sure, these people who are employed in the government, doctors on employment, they are not working. They are interns who are doing the big work. And again, they are not going to get their allowances, which means the person who is hungry is going to work on a person. How can you resuscitate a person when you are also needed to be resuscitated? You are also hungry.
However, most of them caution the government to have their salaries reserved always, as a priority being that they are the backbones of health.
Maybe they could solve the issues with the intern doctors. I understand that they are demanding more pay. So I would say maybe they could find a way to take care of that issue so that the doctors can be able to have the pay they deserve and maybe be motivated to work on patients and all that. And basically, maybe I would also say accountability. So we know what we spend our money on and we see the results.
At least whatever they promised, like for the salaries, they should give us our pay, because they've taken like 2 months without paying, others in other districts of government. So I expect that they release enough money so that also our accounts are accredited.
Increase some money to those people in the nurses, because the nurses get really a little money, yet they do a lot of work. They are on facilities from morning to evening. They get little money. So
I really presume that they should talk about how they are going to enhance payments of medical workers, most especially the public sector, but also to enhance the work of the private workers, so that they are motivated to work just like the way the government personnel are motivated.
Tomorrow we are bringing you the Ugandan National Budget of 2023-2024. Henry Mugwanya, Nina Namleme, live at 8.